A new study finds most commonly used antidepressant drugs are ineffective in children. ABC 7's Alex Redmond talked to a Sarasota psychiatrist about how this may affect young people who are suffering from depression. Alex.
Thanks, Haley. This is not the first time questions have been raised about the usefulness of antidepressants in young people whose brains are still developing. This is what depression can feel like.
You lose all will to move or do anything, and just getting out of bed, simple things like washing yourself and brushing your teeth.
These become completely arduous tasks that seem impossible to do, says 18-year-old Rose Kordonsky.
I had a lot of issues with depression. My parents just got divorced. I was getting bullied a lot. It was very difficult for me to deal with when I was younger.
Depression doesn't only affect adults, but it also affects children. And now a new study finds that most antidepressants don't work for children.
And I was scared that if I went on medications, I would become overly reliant on it, and then I would just become more dysfunctional than before.
Kordonsky says she uses alternative therapies like yoga and meditation and trying new things to combat depressive feelings.
After a trial of therapy, if it seems that the symptoms of depression are not improving, that's when you should consider treatment with an antidepressant.
Dr. Christina DeGea is certified in adult and child psychiatry and says depression can be cyclical and having interventional therapy can be helpful. But if there's no improvement over time, parents may want to consider medication.
And if the kids are still feeling suicidal, if they have thoughts of self-injury, if their grades continue to drop, if they're not eating, sleeping too little or sleeping too much.
A new study published in The Lancet is the biggest analysis conducted to date of previously published studies. Researchers looked at 14 antidepressants and found only one drug seemed useful.
It appears that fluoxetine, which the brand name is Prozac, according to them, seems to be the one that has the most efficacy. I know that Prozac is the one that is FDA approved. There is one other one that I know of that is FDA approved, which is called Lexapro. Generic name is escitalopram, but even that's not indicated for kids younger than 12.
The researchers found of 14 regularly prescribed drugs, only Prozac proved effective enough to justify giving to children and teens.
And Alex, is there a concern for parents that they maybe want to take their kids off of the drugs or not start them in the first place because of this study?
Yeah, Dr. DeGea said that there's always a concern when a new study comes out, but the decisions to change any medication, to stop any medication, or not to give any medication should always be a decision between the physician and the family. Parents should not discontinue or not use something on their own accord.
And antidepressants are one of those you cannot stop immediately. That's something you have to work with your doctor. All right, thank you, Alex.